You have spent the last 54 years at the National Institutes of Health in one capacity or another. And in a few days, you're going to be driving off that campus for the last time. Have you thought much about how that's going to feel?
You know, I've tried to put off thinking how that's going to feel because I think it's going to be really quite bittersweet. I've been, as you say, driving onto that campus every day, almost every Saturday, and sometimes many Sundays, literally for the 54 years. The idea of not officially coming back on the campus is kind of a strange feeling, excitement about what's ahead, but, sadness about leaving a part of my life that's, 54 years, a half a century plus 54.
You turn 82, I saw, on Christmas Eve.
Yes.
You're still going strong. We're still in a pandemic. Why are you leaving?
Well, I wanted to have at least a few years where I still feel very energetic, passionate about public health. I want to be able to do things that are contributing to society, particularly to my field of public health, and perhaps use what I have accumulated over the years, which is experience, the fact that I've had the privilege of advising 7 presidents. I've directed the Institute for 38 years. Hopefully, I can translate that with writing, with lecturing, with advising, to perhaps inspire the younger generation of people who are either in science or considering going into science, to maybe get them excited about doing something that I feel strongly about.
I wanted to, honestly, and it's a tough question, but did the security threats against you and your family, did all the political attacks, did that play any role in your feeling enough?
Quite frankly, Chris, no, it did not. It's a bit bizarre, I think, in our day and age to have health officials who are doing nothing more than trying to get people to be safe and save their health and their lives and their family, to get attacked in a way, not only me, but my family, my children and my wife. That is really bizarre. But in a frank answer to your question, that did not influence my leaving.
You may be done with political life, but political life is not going to be done with you. Congressman James Comer, Republican, the incoming chair of the House Oversight Committee, says that he has lots of questions for you.
He's done everything he can to obstruct any type of investigation, even from the intelligence community early on and from the Trump administration, to try to determine the origination of COVID-19.
What are you going to do if, in your view, you become a punching bag for Republican critics?
Well, if I become a punching bag, I'm a punching bag, but I am very happy to testify before any Congressional Oversight Committee. I have nothing to hide. I can explain and validate everything that I've done. So, it's going to be inconvenient if they actually are out there essentially threatening to make my life miserable. But I'm going to do what I need to do, and that is cooperate fully, because we have nothing to hide at all.
You have also taken some hits about some comments you made last year. Here.
If they get up and criticize science, nobody's going to know what they're talking about. But if they get up and really aim their bullets at Tony Fauci, well, people could recognize there's a person there, there's a face, there's a voice you can recognize, you see him on television. So it's easy to criticize. But they're really criticizing science, because I represent science. That's dangerous. To me, that's more dangerous than the slings and the arrows that get thrown at me.
Your critics accuse you of hubris.
Right.
They say that you express a certainty and a disregard for the views of others. Yeah. Can you understand when you say, I represent science?
Sure, I can understand how that could have been taken out of context, and I probably had to do it all over again, would have changed the wording a little bit of that. What I was trying to say, Chris, is that what I was doing was saying, here are the data of why vaccines are safe and effective, so we should be getting people vaccinated. So when you're criticizing me, you're actually criticizing the scientific facts, because I'm just the vocal and visible vehicle of the scientific facts. That's what I meant when I was saying you're criticizing science. I wasn't mean to be that, oh, holy me, I'm science. That's not what I was talking about.
What do you think of Donald Trump?
Well, I don't want to get into the politics of it, so it is irrelevant what I think of Donald Trump.
Well, what do you think of him from a public health standpoint?
Well, as you know, I had difficulty in that administration because what was happening is that it became very clear that things were being said by the president, those around him, which were just not based on any scientific fact and data. In fact, it was contrary to what the data was showing. And I felt very uncomfortable about having to publicly get up at the White House press room and being put on the spot to directly disagree with the president. I have such a great deal of respect for the office of presidency that it just made me very uncomfortable. But I had to do it, Chris, because I couldn't stand there and be complicit in saying hydroxychloroquine works when it doesn't. Bleach works, it doesn't. And that's how I evolved essentially in the public enemy number one of the far right, which I did not desire to be put in that position. But in order to maintain my own scientific and personal integrity, and most importantly, fulfill my responsibility to the American public, I had to do that.